Welcome to part 2 of Anterior Thoracic Wall presentation. This presentation addresses the age-related changes in the anterior thoracic wall that result in immunological changes during the aging process. As people age, their immune systems undergo various changes. One significant change is the reduction in the production of new immune cells, such as T cells and B cells. Additionally, the existing immune cells may not function as effectively as they did in younger years. This leads to increased susceptibility to infections, a reduced vaccine response, autoimmune diseases, and chronic inflammatory diseases. Aging of the immune system involves both immunosenescence, or insufficiency, and inflammation, or overactive immune cells, leading to immune disorders. The bone marrow is responsible for the hematopoiesis process, whereas the thymus is essential for the maturity of immune cells and the formation of inflammation, particularly a chronic low-grade systemic inflammatory phenotype observed in elderly individuals without acute infection. Age-related thymic atrophy impairs negative thymocyte selection, leading to an increase in self-reactive conventional T cells and a decrease in regulatory T cells. The bone marrow accounts for 4%, or 2.8 kilograms, of a 70 kilograms human body weight. A normal bone marrow cavity contains 20% trabecular bone, 50% marrow fat, 25% non-fatty cellular elements, and 5% vascular channels. Age-related changes transform red marrow into fatty marrow from the periphery to the center of the skeleton shortly after birth, shown in Panel A and Panel B. The thymus is important for T cell development and immune function. Age-related thymic atrophy, or involution of the thymus, is the natural process of the thymus gland shrinking and declining in function as we age. The thymus is the largest during childhood and adolescence, but it decreases in size with age, as shown in A and B panels. The involution process starts in puberty and lasts into adulthood. In old age, the thymus is smaller and has more fatty tissue, shown in C panel. The aging thymus shows reduced central tolerance and thymopoiesis. Ineffective central tolerance includes impaired negative selection, leading to increased self-reactive T cells, attacking self-tissues and organs, and an imbalanced generation of TCR repertoire, failing to suppress autoimmune responses. Autoimmune responses cause tissue damage and contribute to inflammation. Reduced thymopoiesis decreases naive T cell output, leading to the accumulation of senescent somatic cells due to the insufficient clearance capacity of oligoclonal T cells in the aged periphery. SSCs are a source of SASP, which contributes to inflammation. The immune system changes with age, affecting immune cell production, function, and distribution. These changes include reduced naive T cell production. Aging reduces the ability of immune system to recognize and respond to new infections. Accumulation of memory T cells, long-lived T cells that remember antigens and respond quickly when re-exposed. Aging accumulates memory T cells, skewing the T cell repertoire and affecting immunological reactivity. Aging affects B cells, which produce antibodies. Older adults have more autoreactive B cells, which can cause autoimmune diseases. Changes in innate immune cells. Aging can affect NK and macrophages. These cells help fight infections and cancer early. Their function and distribution alter the immunological response. In general, impaired immune responses associated with aging result in persistent low-level inflammation, also known as inflammaging. This persistent immune activation can have a detrimental impact on immune cell function and contribute to an increase in pro-inflammatory cytokines, such as TNF-alpha, IL-6, and IL-17, as well as age-related diseases. Overall, the thymus atrophy consequences for health and clinical outcomes with increasing age including thymus atrophy reduces mature and functional T cell production, lowering the immunological response against infections and certain malignancies. Thymus atrophy impairs immunological surveillance and infection response in older people. It decreases immune function, T cell generation, and impairs immune function. Without enough T cells, the immune system struggles to fight several diseases including risk of respiratory infections, viral disorders, and certain cancers. Thymus atrophy slows wound healing. T cells restore tissue and modulate inflammation during wound healing. Older people recover slowly and less effectively due to diminished T-cell activation. Aging is a complex process that depends on environmental, genetic, and lifestyle factors. As a person ages, their body undergoes natural changes in the thoracic wall, including connective tissue becomes less flexible. Anatomical remodeling favors loss of homeostasis in face of stress such as hypoxia. Sarcopenia and myostenosis on the thoracic wall in older adults. Early thymus atrophy reduces the production of naive T cells. Immunosenescence and inflammation intersect with thymic involution associated with aging, resulting in increased inflammaging. Multiple age-related pathologies are associated with the increased prevalence of inflammaging in older adults. Thank you for watching this presentation.